Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T UVerse on Channel 99. I'm Dr. David Bali, and I'm your host for In a Heartbeat. Parents, grandparents, aunts and uncles, and teachers alike, I think you'll want to pull up a chair and listen to what we have to say in our program today. My guests will share a lot of valuable information about the children in your life, especially as it relates to some of the most serious and perhaps unwanted medical issues that they may face. I'm really excited about my special guest today. He is the Chief of Pediatric Surgery at St. John Hospital and Medical Center, and his name is Dr. Mark Cullen. Dr. Cullen, welcome to In a Heartbeat.
Good morning. Thank you, David.
Thank you so much for taking time out of your busy schedule to be with us here, today. I'm really excited about it.
Oh, good. Well, let's see what we can do.
Dr. Cullen, first of all, what inspired you to follow the path that led you to do what you do today? Why pediatric surgery?
I think it's kind of complicated, David. I know that one would assume that it's just purely out of a love of children, but really my first love was the surgery part of it. And pediatric surgery is actually the last bastion of general surgery. Pediatric surgeons operate on children for all the conditions that an adult might have, but think of it as being miniaturized. We don't do children's hearts, their brains, or their bones, because those require additional specialists. But think of what a general surgeon would do, and that's what we as pediatric surgeons do. The nice thing about children is that they're usually healthy. They may require a single operation or a single solution to a problem that has come up. They heal quickly, and everyone is very, very grateful for it. So it adds an opportunity to do something that's very meticulous and that has a benefit that's multiplied over the life of that child.
And thank God somebody like you does this. We need you. And do you have any particular areas of special interest that you may like to focus your practice on?
I really do. I mean, as pediatric surgeons, we're always interested in babies with congenital anomalies, and that even starts before the time of their birth. We counsel a number of women who have, by ultrasound, been told that they have a baby that's affected by a problem that may need surgery afterwards. And it's really important to make contact and a connection with those patients to relieve some of their anxiety about what is, for most people, a joyous occasion, but for them may be accompanied by trepidation about what what problems the baby's going to face. So the congenital anomalies as an infant is an important part of it. The second part has been in injury prevention. I've run the burn unit at the Children's Hospital for 25 years before coming to St. John's, and in that capacity I've had the opportunity to take care of children who've been injured, and in a majority of instances by preventable conditions. These are kitchen burns and bathtub scalds and things that happen in the household, and many of them are preventable.
And I really would like us to touch upon that today, because I think obviously prevention is a key important part of medicine, and we'll make sure that we address that issue. I really think it takes a very special person, I really do, with a warm heart and compassion to take care of traumatized and injured children. And you're dealing not only with these young bodies, but also the parents and the family, who are probably much more worried or concerned than often the patient themselves. How do you do that?
Well, I think that's really important. There really is a partnership, and people have to understand that when you're taking care of someone's child, you're really engaging the entire family. You're engaging both their concerns, some of the prejudices they bring, and often guilt, because it may have been a moment of inattention that resulted in an accident or injury that may have occurred. So we really want to engage them in a partnership in the care of their child so they understand what's going to happen, because they're our best ally in reducing the child's fears and assisting in their recovery.
If there is such a thing, Dr. Cullen, what might a typical day be for you? You're walking into the hospital, and what happens?
Well, I think that's very interesting. I don't know, maybe in your practice as a dermatologist it may be more predictable, but it really is an anything goes type of situation. St. John has a very busy emergency room. They have a very busy delivery service, so that any given day a baby could be born, someone come in through the doors of the emergency room. We have office patients, inpatients, as well as an elective surgery schedule. And so it's a little bit of a juggling act, and there's never a dull moment.
I believe it, and thank God you can take care of that. You had mentioned that you ran the burn unit at Children's Hospital for quite a period of time, which is a vast amount of experience. What are some of the most important issues that burn victims face, and how have you been able to bring your experience over to St. John Hospital?
I think it's complicated. I think that there's a number of problems that are very, very common, and you know that there's children underfoot, especially in the kitchen at times of cooking. Accidents happen, a pot left too close to the counter, a cord left dangling. Even the cup of coffee that we have here today, someone could reach up and grab the handle and sustain a scald injury. And water, even at 130 degrees, can cause a pretty serious burn. And so these are the things that happen, and I think that there's some fear, some lack of information that sometimes compounds the initial response to it. I think people have to accept that an accident has happened. They want to limit the problems that may occur. Rapidly reducing the temperature of the skin really limits the injury, and then seeking medical care as soon as possible for a serious injury is really important. There really are no barriers to any of our patients in this community coming in and seeing any of us at any time. It's not as if it takes
so we don't have to go into the emergency room to see you.
Well, I think that sometimes people have a fear about the emergency room, but they really can be your friend. And St. John's emergency room has gotten very user-friendly. It's a totally renovated space with pediatric emergency room specialists on call throughout the day. And we're there for backup. And so I really do think that it's a very streamlined experience, especially for a child with injury, to get the care they need immediately.
What has research done to help advances in terms of treatment and healing in, say, for example, a burn victim?
Well, I think for the ordinary ones, that the therapies we've had for the last 20 or 30 years are pretty successful. There are new, though, modalities, especially with combinations of biological products mixed with synthetic membranes that are being used to provide skin coverage. And in fact, since probably the mid-1980s, we've been able to grow skin in tissue culture. And now it's actually a commercial venture. So for the patients with the most serious burns, those covering the majority of their body, there's hope that didn't exist before. Conventional skin grafting isn't a good solution for a person in whom 90% of their skin has been burned. Mm-hmm. But for that person, if we can grow their skin in tissue culture and then apply it to them, it gives them a chance for a reasonable and meaningful and purposeful recovery.
It's really amazing, you know, if you take time to think about it, that you can grow skin and tissue culture for a patient. It's really almost like something out of a movie.
Well, it really is, and I think that it was one of the entries, one of the kind of gateway projects that has helped us all think about growing a lot of different cell lines in tissue culture that may be used for organ transplantation and other things. And I know that there's a celebrated case from Newsweek where they grew an ear, a cartilage model of an ear on the back of a mouse. But all of these tissues can, with the right environment and the right media, be grown in tissue culture to replicate heart valves, to replicate muscle tissue, liver cells, and as well as skin cells.
Hopefully neurologic tissue as well.
Correct.
Dr. Cullen, you were also director of the trauma unit or the trauma center at Children's Hospital. What is that like?
Well, I think that's a very, very challenging job. And I thought going into pediatric surgery that I'd never have to deal with trauma. I said, if I'm taking care of children, I'll never have to deal with people with varicose veins, or I never have to deal with people with trauma. But it became very clear that injury is really, for children under the age of 4 or 5, perhaps the most common cause of death for them. And so with burns being one part of it, the others are car accidents, bike accidents, and falls, and even in any big urban center, there's problems with assault. And so it was a very big challenge. It's a very surprisingly, at any children's hospital, and any hospitals committed to the care of children in this country, kids are coming in every single day as a result of injuries. We've done a great job in some ways. We have seat belts and car seats and bike helmets, and those help reduce the impact of those injuries. But getting the message out to prevent them in the first place would be an important part of our mission.
Absolutely. Dr. Cullen, you've also mentioned that you have a special interest in treating vascular malformations. What is a vascular malformation for our viewers?
Well, that's a good question, David. As a dermatologist, I really, and you understand how important your skin is, and as a burn surgeon, we felt that we had a special collegiality or a special bond with the dermatologist who send us patients. And I think that both pediatricians, dermatologists, and pediatric surgeons will see children who have birthmarks.
Yes.
It's pretty common.
Mm-hmm.
But there's a lot of misunderstanding about them. I mean, every little spot on your skin that's red is not necessarily going to go away by the time that you're 4. And I think that's a classic misconception about these things that we call hemangiomas or capillary hemangiomas. And so that this concept of the blood vessels within our body and how they've been laid down and created sometimes goes awry, and there's a great deal of overlap between those that are due to the smallest vessels that are called capillaries and those that are due to the arteries or veins. And so it's been a special interest of mine because it's something that's manifested in the skin to understand the causes of these and the modern treatments of them for those patients who actually may need help taking care of those lesions that are in critical areas or that may not go away without help.
Dr. Cullen, for any of our viewers who may be listening, what are some of the modern treatments for these vascular anomalies or abnormalities?
Right. Well, I think that I've had actually personal experience with this. My youngest daughter was born with this little thing down her chest that no one thought was very significant, and she was delivered here locally, and the pediatrician said, "Oh, will go away." And in fact, it was a sizable congenital hemangioma on her chest wall. And so we actually saw John Milliken, who's the chief of plastic surgery at the Boston Children's Hospital, and she was put on corticosteroids as an infant to make that go away. And by corticosteroids, I mean prednisone.
Mm-hmm.
And doesn't taste great, difficult to get a little baby to take,
sure.
But hopefully it slowed the growth of it, and now she's 16 and you can barely see the spot where this, I would say, cantaloupe-size lesion on her skin was. She was much more okay with it than I was. There was never a time that she wouldn't wear a sundress, and I was always wanting to put her in a T-shirt. But I think she was quite proud of it almost. Nowadays, we still
probably great in a way for her.
It's that same resilience that we talk about in terms of kids' ability to deal with illness, probably better than their parents.